Hello all. Today we'll be discussing an advanced and powerful technique in the field of physiotherapy that is called Proprioceptive Neuromuscular Facilitation, simply saying PNF. So coming to the introduction of PNF, PNF was developed in the 1940s by Dr. Herman Kabat and Margaret Knott. Initially, it was used in the treatment of neurological disorders like polio and multiple sclerosis. But what makes PNF special? So PNF takes a holistic approach. It doesn't just treat a symptom, it focuses on improving the entire functional moment of the patient. So it integrates sensory input, motor responses, and functional goals of the patient as well. So coming to the core concept in rehabilitation, so PNF is about facilitating or enhancing neuromuscular responses. So that means we use specific patterns and cues to help the nervous system and muscles to work better together. So it based on proprioceptive input, that is stimulating sensory receptors in the muscles and joints. So what is the goal? So to restore or to improve the functional movement like walking or reaching or getting out of the bed, such stuffs. And coming to the fundamental principles of PNF, the first thing is manual contact. The therapist's hands guides the motion and providing supports and feedback to the patient. So the second thing is maximum resistance. The resistance is given throughout the range to promote strong, smooth muscle contractions. The third one is traction and approximation. These techniques stimulate joint receptors of either mobility, that is traction, or stability, approximation. So stretch stimulus. Muscles are elongated to trigger stronger contractions. And the fifth one is verbal commands. Simple and clear cues like push, hold, relax, improves the patient's responses. The sixth one is visual input. The patient use their eyes to follow the movement, helping with control. And the seventh one is timing of the movement. So muscles should activate in correct sequences. Eighth one is diagonal and spiral patterns. So the movements are basically functional, not in a straight line, and they also follow natural body mechanics. So that is what's specialty about the core concept of PNF. So coming to the applying the PNF principles from resistance to verbal cues. So this is what I told about before, that is the manual contact, optimal resistance, verbal commands, visual input and all. So the PNF patterns of motion, that is the diagonal in nature. So initially we'll be putting a diagonal and spiral is nothing but the PNF utilizes complex and multiple joint patterns. The same goes with the functional movements and integrated muscle chains as well. Coming to the first thing, that is upper extremity pattern, it is nothing but D1 flexion. So usually the arm moves across the body like pulling up a seat belt, whereas in D1 extension the arm pushes down and away like closing a car door. Whereas in D2 flexion the arm moves up and out like drawing a sword kind of steps, whereas in D2 extension pulling the sword back. In such way the movement will be happening. Whereas in lower extremity D1 flexion, it is nothing but kicking a ball across the body, whereas in D1 extension it is nothing but like pushing off a skateboard, whereas in D2 flexion it is like stepping over a huddle kind of stuffs, whereas in D2 extension it is nothing but putting on a socks like of movement will be happening in D2 extension. Yeah, coming to the diagnosis and assessment through PNF, identifying impairment. So then it is nothing but initially we'll be assessing movement limitations, muscle weakness, and coordination deficits. By observing how a patient moves through the patterns, we can target specific impairments and build an effective treatment plan. So in order with, we'll be assessing all those stuffs. Yeah, what is the functional relevance and integration? It is nothing but motion components and clinical integrations. So, what is PNF? Why is PNF so useful? Because it is not just about strength and flexibility alone. It is about combining strength, coordination, and movement control as well. So, into the real life action. So, these techniques help patients walk more efficiently, regain upper limb control, improve core and trunk stability, become more independent in daily tasks. That is what we have told about here. That is three components, that is rotational, diagonal, and flexion and extension will be given together, whereas it is 100% functional, whereas unlike any other therapy, not just a straight line movement will be given. The whatever the movement is given, it's almost like a functional, that is in a day-to-day or daily activities kind of stuffs. That is 1%, it is integrated, that it combines the strength, flexibility, and coordination of the patient. Yes, coming to the conclusion, why learn PNF? So PNF is versatile and it is evidence-based technique. It is applicable in neurological, orthopedic, and sports rehabilitation. So learning PNF will help you think beyond isolated movements and treat your patients functionally and holistically. Yeah, this is all about PNF. Thank you for your attention. If you would like, we can move into the demonstration on practical for PNF.